to ensure enough bed capacity to manage critical patients. These figures and trends make it clear that our region must redouble preventive measures, especially in preparation for the year end holidays. Now is not the time to relax. So it's important for health authorities in our region to act by issuing clear guidance and helping communities protect themselves and their loved ones. We are once again in need of coordinated efforts to boost hospital capacity in the most affected areas. Because when hospitals can't accommodate everyone who's sick, many will die while waiting for care. We are hopeful that the COVID-19 vaccines, which will soon come to market, will help contain the pandemic. But this will take time and advanced planning. So, we'd like to share an update on our region's preparations for a successful vaccine rollout. Let me start by saying that while a number of vaccine candidates are under consideration, no vaccine has been approved for distribution across our region yet. This week, PAHO is convening member states in an extraordinary session of our Directing Council where we'll meet with the ministers of health of our region to discuss the preparation for vaccine rollout and the purchasing and distribution of COVID 19 vaccines in the region through our revolving fund and through the COVAX facility. Despite the financial hardships that our region has incurred during the pandemic, countries in the Americas have done their part in securing more than $1 billion in down payments and financial guarantees to engage with COVAX. PAHO has helped several countries in our region navigate and meet the requirements of the COVAX facility, and we're focused on making sure that every country's investment counts. The Americas represent a fifth of all COVAX participating countries and an estimated one-third of all vaccines that will be procured for self-financing countries via COVAX. But funding is just one area in which we are supporting our member states. We're also working hard to ensure that once vaccines are approved and available, countries are prepared to roll them out. The World Health Organization has developed a readiness assessment tool that PAHO has adapted for our region to ensure that our member states have the guidance that they need on everything from engaging the staff, from regulatory aspects, communication, resources, and the trainings needed to prepare the health systems for vaccination campaigns, to ensuring their logistics systems, cold chains, and supply chains, and to ensure that all of those can respond quickly. At first, we will not have enough doses to protect everyone. So the objective is to save lives using the first deployment to reach those most vulnerable to develop severe forms of COVID-19. And that's why PAHO has also been supporting member states in developing their national immunization plans. Each country must identify priority groups and adapt the communications campaigns and materials to meet their needs, including by working alongside community leaders to empower communities to seek vaccination. Healthcare workers will likely be among the first to benefit from a vaccine and will also play a key role in raising awareness about the importance of immunizations. To help us keep track of and accountable to progress across all of these areas, PAHO has developed a dashboard, which is live and available for anyone to view. It shows the number of countries that have completed, are working on, or have not yet started preparations. This week, we will observe Universal Health Coverage Day. And the impetus behind our work on vaccine access and the motivation behind the COVAX facility is to ensure equal access to safe and effective COVID 19 vaccines. The principles of solidarity, equity, and leaving no one behind have guided PAHO's response to this pandemic from the very beginning. And that's why PAHO has sent more than 20 million COVID 19 PCR tests to give countries better visibility into how the virus is spreading and to help identify those who are infected so they can receive the care that they need. Many donors have supported us in this effort, and we want to thank them. That's why PAHO has also donated nearly 36 million masks, 3 million gloves, and more than 1.5 million gowns to protect health workers across our region. And that's why we have led over 200 virtual and in person trainings to ensure that ministries of health and practitioners alike understand the latest science and have the skills that they need to combat this virus. The principles of timely access, affordability, and regional solidarity are grounding not just our COVID 19 response or the planning for equitable access to our vaccine, they're guiding our work for over 120 years. And they are enshrined in our region's commitment to health for all. This Saturday marks the observance of Universal Health Coverage Day, an annual event that takes renewed importance during this year of the pandemic. This day serves as a reminder that universal health is not just about ensuring that everyone is covered, but that everyone has access to care when they need it, wherever they are. Health is multidimensional. So, fulfilling this vision will require an all of society effort to combat factors that prevent our people from getting the care they need, such as poverty, social injustice, and educational gaps. But as we've seen so clearly with COVID 19, ensuring that people are safe and healthy is foundational to the health of our economies and the health of our nations. Thank you.
Muchas gracias, doctora Etienne. Ahora vamos a pasar a la parte de preguntas y respuestas. Recuerden al escribirnos por el QIA, incluir su nombre y su medio de comunicación. Ya estamos recibiendo varias preguntas. Una de las preguntas que nos llegó en inglés dice lo siguiente. As the pandemic is likely to continue to affect the region for the coming month, what are the collateral impacts that are you most worried about, Dr. Etienne?
So, thank you for this question. You've heard me say, and PAHO has said on many occasions, that COVID 19 has ushered what we refer to as a triple crisis that affects our health, our economies, and our societies. And this pandemic has proven that health is foundational to the fabric of our societies and the state of our economies. Food and nutrition is vital to good health. And for me, that's why I'm concerned about the level of food insecurity that this pandemic has brought upon our region. So, even before the first case of COVID was reported in the Americas, 1 in 3 people in our region did not have enough food and they lacked access to nutritious food. But today, hundreds of millions of people across Latin America and the Caribbean, they don't know when their next meal will come. And what is more important, children are especially at risk. UNICEF has estimated that over 141 million children and teens are out of school in our region. And for many of these kids, missing school means missing meals. We know that without the proper food and nutrition, children can suffer irreversible damage to their physical and, and to their cognitive development. And this we know can lead to poor school performance and can hinder their ability to develop to their full potential later in life. So I believe that the impact on children and on their ability to flourish should be prioritized. And so that's why PAHO has been working with the Organization of American States to ensure that schools in our region can help kids to meet their full potential. This is also why we are in discussion with UNICEF and soon with UNESCO, so we can begin to work together on some solid guidelines for the reopening of schools and maintaining health and safety within our region. So for me, this is a priority now, and once the pandemic is over, we will need to ensure that this continues to be a priority.
Gracias, doctora Etienne. La siguiente pregunta es de Anthony Boadl de Reuters News en Brasilia. Dice, how soon does PAHO think there will be a vaccine rolled out for the population of Latin America? The African Union said last week it would take 2 to 3 years to get 60% of the African population vaccinated. What is your forecast for how many years it will take to vaccinate 60% of Latin Americans? And is 60% enough to attain herd immunity? Y otra pregunta de Anthony es, are some Latin American countries in better shape in lining up the supply and distribution of vaccines than others? Dr. Barbosa?
Thank you for these questions, Anthony. Let me tell you, we are our focus now is to guarantee that the first phase for 2021, and the first phase is to have a vaccine that will be enough vaccines to protect the most vulnerable population and to save lives. So with these vaccines that correspond to around 20% of the population of each country, we will be able to protect health workers, social workers that are in the front line, people with 65 years and more, and other adults with underlying condition, because these people can develop a severe form of COVID-19. So this is the first objective that we have. We don't know how many doses will be produced in 2021 or 2022 yet. Probably we will have this information in the following weeks or even months. So this is our first objective. About the 60%, we don't really know yet what is what is the coverage that we need to interrupt the transmission. Based on other diseases and other vaccines, WHO has an estimation that we will need to reach at least 70% of the population being protected in order to interrupt the transmission. But this is still a hypothesis. We will need to have more research and more information to confirm this. So to reach this level, or to think about not only to save lives, but also to eliminate the transmission of COVID-19, we will need to know, first, what is the availability of vaccines that we will have. Secondly, what is the real level of coverage that you need to reach. But again, let's take step by step. The first step, and it's a huge step, is to vaccinate this 20% of each population to protect the most vulnerable groups and to save lives. And this is a very important challenge to every country worldwide. And for this reason, we are supporting these countries in Latin America, the Caribbean region to have their national immunization plans to be ready for vaccine rollout. Thank you.
Gracias, doctor Barbosa. La siguiente pregunta es de Valeria Heredia, del diario El Comercio de Ecuador. Valeria pregunta si ya han llegado los test de antígenos que había dicho OPS que estaba enviando al país. Doctor Aldiguieri, ¿podría actualizarnos?
Sí, gracias por esa pregunta de seguimiento muy estrecho de Ecuador. Si me permite, voy a ampliar también sobre aspectos más de nuestra política a nivel regional para acceso a nuevos diagnósticos. Puedo informar que sí, las pruebas de detección de antígeno, que son una donación de la OPS, han llegado a Ecuador hace 2 semanas. Puedo también informar que hemos movilizado una misión de expertos la semana pasada que trabajó de manera cercana y toda la semana con autoridades del Ministerio de Salud Pública para capacitar la cadena de mando y los operadores para la utilización de esas pruebas rápidas de detección de antígeno. Esas pruebas tienen como objetivo de asegurar la expansión de la red de laboratorio, de la red de detección de laboratorio en zonas remotas, zonas de acceso difícil, en provincias de la costa y de la sierra ecuatoriana, y se van a complementar la red existente del INSPI y de otras agencias, otras instituciones ecuatorianas para detección con la técnica PCR. Y esperamos muchas lecciones aprendidas en Ecuador especialmente sobre el uso a nivel de atención primaria de esas pruebas de detección de antígeno. Y la OPS está trabajando también a nivel global a través de la iniciativa ACT acelerador, para que los países de las Américas puedan tener acceso a pruebas, nuevas pruebas de diagnóstico eficientes y costo eficiente también para un uso a nivel de atención primaria. Gracias.
Gracias, doctor. La siguiente pregunta es de Adolfo Cuicas, periodista del diario peruano La República. Dice, la ministra de Salud del Perú, Pilar Macetti, aseguró que existe la amenaza real de que haya una segunda ola de la COVID-19 en el país y pregunta cuáles son las expectativas de la OPS al respecto y también en general a nivel latinoamericano quiere saber si hay países que estén enfrentando ya una segunda ola como sucede en Europa. Doctor Espinal.
Sí, muchas gracias, Adolfo, por la pregunta muy importante. Creemos que la ministra tiene toda la razón. La honorable ministra Macetti ha alertado a la población porque, como hemos visto en Europa, que pasa por una segunda ola, también ya estamos viendo países en Latinoamérica que están viendo aumentos o signos de una segunda ola. Entre ellos Brasil, que ya está reportando más de 50.000 casos, cuando hace un mes reportaba ya unos 20.000, 27. Y hay estados en Brasil que están reportando. Uruguay, que había aplanado la curva, también está viendo aumentos de casos. México, hemos visto que también aumentan los casos. Entonces, creemos que la ministra tiene toda la razón y lo que ella quiere decir es que no se debe bajar la guardia, continuar con las medidas de mitigación, continuar con los programas educativos. La población tiene que poner de su parte porque Perú es un país con selva, con mar y con Amazonas y con montañas. y grupos poblacionales viviendo en situación de extrema vulnerabilidad, entonces las medidas no pueden ser relajadas y es necesario que se continúen. Sí, Perú está en riesgo de tener una segunda ola y la única forma de poder minimizar, controlar la posibilidad de esa segunda ola es manteniendo dichas medidas y combinando esas medidas, ya que, como decía la directora en uno de sus anteriores discursos, estamos ante la presencia de un problema no solamente de salud pública, pero también social y económico. Muchas gracias.
Muchas gracias, doctor. I would like to give the floor now to Jacqueline Charles from the Miami Herald to make her question. Jacqueline, if you're listening, Jacqueline Charles, si nos estás escuchando.
Yes. Hi, can you hear me?
Yes, go ahead. Thank you.
Okay, great. Thank you. I have two questions. The first one has to do with Haiti. Earlier this year, PAHO sounded the alarm on expected deaths from COVID-19. Even with its limited testing, anecdotal reports show that the country has not been hit as severely as expected. And even when people have gotten coronavirus, they haven't died in the large numbers that we thought they would. In fact, a few months ago, Doctors Without Borders shut down their COVID hospital. The experience of Haiti, of course, is viewed similar to some African nations. Do we know why the virus has not hit as hard in Haiti as elsewhere in the region, including like the Dominican Republic? Is there a different strain of the virus? And then the next question speaks to what Dr. Etienne talked about in her opening in terms of the Caribbean. With the holidays approaching and COVID-19 continuing to spike in the Caribbean, what advice is PAHO offering to these countries? We're seeing various response from Jamaica saying don't come, to Haiti and the Bahamas telling people to come, even though they are among 18 countries the CDC recently issued a level 4 travel warning for.
Gracias, Jacqueline. Quizás podemos empezar con el doctor Aldiguieri para la pregunta de Haití y luego continuar con el doctor Espinal para la pregunta sobre viajes. Doctor Aldiguieri.
Merci, Madame Charles. I'm going to cover the first question regarding specifically Haiti. There is no different strain in Haiti. We have a regional network for monitoring the genomic, the genetic aspects of the strains that are circulating, and no difference regarding virulence has been detected today. And also, it's an aspect that Dr. Etienne and other colleagues have already many times highlighted, is that we have really a mosaic of transmission between countries and sometimes within the same country. So today, Haiti has been mildly affected compared to other countries in the region, but the collateral effects, the socio-economic, health and nutrition are considerable. A recent study, we have some evidence through studies at this moment. The number of cases accumulated as of last week, it's a little bit more than 9,300 cases confirmed by laboratory. The reason for the lower incidence of detected COVID is not completely clear. We have a mosaic in the region. There is a very important serosurvey underway to understand better with partners in Haiti and reference laboratories in Haiti. Nevertheless, it's important to point out that the virus continues to circulate in the country. It means that the risk is there. There are cases every day confirmed by laboratory in Haiti. And the country also is entering a period of risk. There will be a movement of people during the holiday season, visitors, diaspora traveling back to Haiti and coming from countries or regions with a high rate of transmission at this moment. So PAHO is really recommending at this moment to strengthen the surveillance and contact tracing, and especially in some areas and for doing this, Haiti relies on a very strong laboratory network. the 10 departments of Haiti are covered by laboratory network at this moment, and with some initiatives like the Labomoto initiative, which allows the nurses to go to remote area, to remote commune, take sample and travel the same day with the sample to a laboratory. And the network of laboratory will be expanded is in process to be expanded during this period. We anticipate 40 more testing sites to be implemented in the coming days and weeks, and including with the use of the antigen detection rapid test that I have commented previously also for Ecuador. So I hope I have answered your concerns regarding Haiti. Over to you.
Gracias, doctor. Para la segunda pregunta, entonces, pasamos al doctor Espinal. La pregunta relacionada con los periodos festivos y los viajes. Doctor Espinal.
Thank you, Jacqueline, for such an important question. I think the advice is, if we can avoid traveling and only to undertake essential traveling, we should avoid it. Because it's much better to spend many years doing holidays than to have one that could be very negative for us. So if we can, spare this one and maybe do a holiday season, Christmas Day, New Year's Eve on Zoom or on Teams or Skype or any other virtual meetings, I think that's important. Traveling is risky. We have seen that. There's so many calls in the United States about Thanksgiving, and we can expect a larger upsurge in the Christmas holidays. So while we understand the need for to see loved ones and spend some time, it is important to think also about our own health. Many countries in the Caribbean has kept the virus at bay with excellent mitigation actions and prevention actions recommended by PAHO and WHO. So, but the risk is not yet gone. The vaccine, as our previous speakers were saying, is not going to come tomorrow. And you heard that it's going to take probably more than a year to vaccinate the entire world. So we're not going to go back to the normality immediately. And there is an increased risk. So the advice is not to relax the measures, to continue protecting ourselves, to continue avoiding risky situations, because this virus can kill. It also can be mild and moderate, but also can kill, and we have seen so many deaths. So let's think before undertaking traveling that is not essential. Thank you.
Gracias, doctor Espinal. Me gustaría ahora darle la palabra a Melina Ochoa, reportera de UNO TV en México, para que haga su pregunta. Melina, si nos estás escuchando, tienes el piso. No, Melina Ochoa de UNO TV, no sé si nos estás escuchando. Ahora sí.
Hola, buenos días. ¿Me escuchan?
Sí, ahora sí, adelante.
Perfecto, muy buenos días. Melina Ochoa, reportera de UNO TV en la Ciudad de México. La pregunta es, pues el día de ayer se anunció un plan de vacunación contra coronavirus aquí en el país, el cual arranca para finales de diciembre y está proyectado en 5 etapas. Este plan inicia con la llegada de la vacuna de Pfizer. ¿Esto es suficiente para mitigar la pandemia en el país? ¿Qué opinión le merece a la OPS? Además que hoy pues hay una información en Reino Unido respecto a algunas reacciones alérgicas con esta vacuna. Muchas gracias.
Gracias, Melina. Doctor Barbosa, ¿podría contestar?
Sí, gracias, Melina. Mira, primero sobre esas reacciones que que se han detectado son reacciones relacionadas con alergias. Eso puede pasar con cualquier vacuna o medicamento. Entonces ya hay una advertencia para las personas que ya tuvieron reacciones alérgicas graves com outras vacunas, não devem tomar essa vacuna de Pfizer. Isso pode passar com qualquer vacuna, não é uma situação que vai impedir as pessoas de ter acesso a qualquer vacuna. Segundo mim, é muito importante que México, como outros países, possam completar seus planos nacionais de imunização. Não basta atender a vacuna. Para uma campanha de vacinação, é necessário muitos outros insumos, como jeringas, como equipos de proteção personal para as pessoas que vão trabalhar na vacuna, a preparação, o treinamento, a comunicação para as pessoas, a definição de los grupos de risco que vão ser vacunados primeiro. Então, isso é muito importante que México já lo está fazendo. Nossa oficina em México trabalha apoiando a Secretaria de Saúde, assim como apoiamos todos os países de la região. La vacuna, nós desde o princípio, estamos trabalhando com a COVAX, o mecanismo COVAX, com a perspectiva de que as vacunas vão chegar para começar a sua utilização ao redor de março ou abril de 2021. Pode ser que chegue uma pequena quantidade antes, pode ser que chegue depois. Pero essa é a fecha que seguimos trabalhando, porque é a fecha que nos parece mais factível. Há países como México e muitos outros que têm acordos bilaterais com alguns produtores e que vão receber, quizás, alguma quantidade, mesmo que uma quantidade pequena, ao final de dezembro, janeiro. Isso não temos toda a informação. Mas seguro que se há plano de vacinação, que é muito importante, qualquer vacuna que chegue vai ser uma vacuna para proteger a los mais vulneráveis, em primeiro lugar, ou seja, os adultos maiores, os trabalhadores de saúde e outros trabalhadores sociais da linha de frente, e outros adultos que tenham alguma condição, como hipertensão, diabetes, câncer, que pode ser risco para desenvolver uma forma grave de Covid-19. Essa vacuna que vai chegar primeiro não vai ser uma vacuna para interromper a transmissão. De novo, isso vai tomar meses, e durante esses meses, Melinda, nós outros temos muita confiança que já sabemos o que é necessário para diminuir a transmissão. Os exemplos ocorreram em muitos países de América Latina, de Europa, de América do Norte, ou seja, manter todas as medidas individuais e coletivas, como a utilização de mascarilhas e cobre-bocas, manter distância das pessoas, não participar em reuniões em lugares cerrados, não sair para atividades que não são essenciais. Ou seja, há muitas, lavar as mãos. Essas medidas são eficazes para proteger a transmissão, porque durante muitos meses se vão passar hasta que se alcance a utilização da vacuna para a interrupção da transmissão. Então, a vacuna é uma excelente notícia, mas não é algo mágico que vá outro dia interromper completamente a transmissão. Há que manter as medidas, e isso vai ser muito importante para que tenhamos a possibilidade de responder de maneira adequada à pandemia. Gracias.
Gracias, doctor. Me gustaría pasar a Blanca Valadez de Milenio en México, también para que haga su pregunta. Blanca, si nos estás escuchando, te doy el micrófono para que pases tu pregunta.
¿Me escuchan?
Sí, adelante.
Hola, muy buenos. ¿Qué tal? Muy buenos días. Disculpen un poco el ruido de la calle, pero quería comentarles, ¿cuándo consideran, ya comentaron que es un plan que se está analizando, pero ¿cuándo podríamos considerar o de qué depende que las personas vuelvan a incorporarse, salir a las calles, volver a abrazarse, besarse, reunirse como antes? ¿O esto va a ser imposible de predecir, digamos, en los próximos, no sé, 2 o 3 años? También comentarles, debido a la vacuna Pfizer, que, bueno, necesita ultracongelación. ¿Cómo está haciendo la OPS y OMS para que pues, los países con menos recursos no se queden sin la vacuna por no contar con este tipo de aparatos sofisticados? Y si me pueden hacer nada más un comentario sobre cómo han visto el manejo de la pandemia en México. Muchas gracias.
Gracias, Blanca. Bueno, varias preguntas. Si podemos empezar con el doctor Espinal.
Bien, muchas gracias, Blanca. La pregunta sobre los cubrebocas y retornar a actividades normales y los abrazos, creo que el doctor Barbosa anteriormente ya aludió a la respuesta. No es bueno hacer proyecciones de tiempo. No podemos desesperarnos. Va a tomar tiempo. Y ya se ha hablado hoy de 1 año, de 2 años. Los cubrebocas en Asia se usan desde tiempos inmemoriales. Entonces, como decía el doctor Barbosa, es una combinación de medidas. No desesperarnos de que vamos a ver estas medidas que se van a ir mañana. Los próximos 2 años van a ser críticos, porque como decíamos antes, la vacunación no va a ser de la noche a la mañana, y para llegar a tener inmunidad de rebaño, hay que tener una gran parte de la población vacunada, 70%, 80, 60, en los 70%. Entonces, eso nos va a ser de inmediato. Pero también, como decía el doctor Barbosa, muchas de las vacunas todavía se están probando y no es que se van a poder utilizar mañana. Entonces, hay que continuar con las medidas, los cubrebocas, el lavado de manos, el evitar espacios cerrados, tratar de hacer las cosas si se va a hacer en grupos pequeños, porque es lo único que nos va a proteger. Como vuelvo y repito, es un virus mortal que todavía no tenemos la respuesta a muchas de las preguntas. Entonces, nuestras poblaciones tienen que ser firmes y atender a los ministerios de salud, las recomendaciones de los ministerios, de los organismos como la OPS, porque nos va a ayudar a preservar la vida. Entonces, yo no me atrevería a poner un timeline o un número de tiempo de meses. Solo sé que los próximos 2 años, por lo menos el 2021 va a ser un año muy crítico, y ya veremos cómo evoluciona y podremos conversar de nuevo sobre esto. Pero mientras tanto, esperamos que en el 2021 vamos a seguir utilizando cubrebocas, y es la recomendación, porque no vamos a alcanzar esa inmunidad de rebaño de inmediato. Muchas gracias.
Gracias, doctor. La siguiente pregunta, vinculada también con lo que preguntaba Blanca, es de Tania Smith Cartwright, del diario Tribune de Bahamas. Dice, given the fact that the COVID-19 vaccine is almost ready for distribution and is considered a high maintenance drug, which can only be stored at -95 degrees Fahrenheit, will PAHO be assisting countries with means of storing this drug when it's made available, as most countries in the region does not have the means to store it? Dr. Barbosa?
Thank you for this question. You see, COVAX facility, and I think that the very important thing about COVAX facility, besides to be a mechanism that for the first time are trying to get equitable access to a vaccine that will be very important to save lives first, and after that to control the transmission, is that in COVAX facilities we are getting a basket of producers. We are not relying in only one producer. When a country makes a bilateral agreement, he is relying only in that specific producer. In COVAX facility, we are in the process, in the bidding process with UNICEF, our revolving fund of PAHO, and we are getting proposals from many different producers. We have one producer that is Pfizer, that its vaccine is requiring this very, very low temperature to be stored, around minus 100 Fahrenheit. But the other producers they have products, they have vaccines that can be storage and can be transported using the current cold chain that the countries have already in their national immunization programs. So this is the kind of information that each country needs to have in order to make the best decisions about what are the vaccines that they want to use. PAHO, through our strategic fund, we are also in contact with the producers of these freezers. They are very specific products. In many countries, they have these freezers being used in hospitals, in some research laboratories and other facilities. But we are trying to get also new producers that some countries that will use the Pfizer vaccine can purchase this kind of freezer. So I think that this is important to have all this information when a country makes a decision that I will make a bilateral agreement with producer A, B, or C. It's important to have this kind of assessment to make a decision based on the facts, based about the best option for each one. And for COVAX, again, we hope by February 4, 5 or more producers, and the countries can choose the best products that have the better combination about affordability, about the cold chain that they have already implemented. So this will be, I think, that the best option for each country.
Gracias, doctor. Tenemos varias preguntas vinculadas con vacunación. Otra que nos llegó al respecto es de Marcela Vélez del Diario Financiero de Chile. Y ella dice que en muchos países la vacuna no será obligatoria y pregunta si la OMS trabajará con los gobiernos en campañas para la población, para la aceptación de la vacuna, y también pregunta si podríamos estar eventualmente en un escenario en que la vacuna sea obligatoria en la región. Doctor Barbosa.
Gracias por la pregunta. Mira, la decisión de la vacuna ser obligatoria es una decisión de cada país, de acuerdo con sus leyes de vacunación. En muchos países de nuestra región hay la obligatoriedad de vacunas para los niños. Creemos que lo más importante hoy no es discutir la obligatoriedad de la vacuna, es discutir la obligatoriedad de tener la vacuna disponible, o sea, tener los planes de vacunación, es fortalecer todos los mecanismos como COVAX en nivel global. COVAX todavía no tiene todos los fondos que van a ser necesarios para apoyar a los países más pobres del mundo. Entonces, es muy importante hacer un llamado a los donantes, a los países ricos que puedan participar de ese mecanismo equitativo. Yo creo que en cada país es muy importante informar bien a la población. Es mostrar para la población que la vacuna contra COVID, las vacunas contra COVID son resultado de un esfuerzo tremendo que dezenas, centenas de centros de investigación, empresas de biotecnología, instituições acadêmicas, produtores de vacunas e medicamentos estão haciendo. E que essas vacunas estão cumprindo com todos os requisitos para assegurar que são vacunas seguras, de qualidade e com eficácia. Então, isso eu creio que é muito importante que todos os governos, como parte de seus planos nacionais para a vacinação, tenham uma comunicação transparente, direta, com todos os dados, para os profissionais de saúde, para as famílias, para as pessoas, ou seja, para que todos possam fazer sua decisão de ter o acesso à vacuna quando a vacuna esteja disponível. Isso eu creio que é o mais importante nesse momento, e estamos, a OPF, apoiando a los países da região no desenvolvimento do plano e brindando também informações para as redes sociais, para os meios, para os periodistas, para os profissionais de saúde sobre a vacuna. Essa eu creio que é a maneira que vamos a ter uma grande adesão da população para a vacuna, primeiro, para salvar vidas e segundo, para alcançar o controle da transmissão. Gracias.
Gracias, doctor. En el chat, Nicolás Luco de El Mercurio en Chile pregunta, ¿son los cementerios y sistemas funerarios de los países focos importantes de contagio? ¿Hay indicaciones al respecto, doctor Aldiguieri?
Sí, gracias por esa pregunta del Mercurio. En esa pregunta hay dos aspectos diferentes y complementarios. Hay primero un aspecto de control de infecciones, quiere decir durante el manejo del cadáver del paciente fallecido por COVID-19, su transporte y finalmente el entierro. Y hay un aspecto relacionado a medidas de salud pública cuanto a las ceremonias, quiere decir agrupamientos de personas, eventos masivos en ambientes religiosos como cementerios. Para los aspectos de control de infecciones, incluyendo el personal de salud, incluyendo el personal de empresas funerarias, OPS ha publicado guías, están en la página web de la OPS, para el manejo del cadáver, incluyendo con equipo de protección personal y la utilización de bolsas mortuarias. Para los aspectos de medidas de salud pública, que todos los países de la región han definido en función de su fase de respuesta a la pandemia, qué medidas de salud pública en términos de agrupamiento de personas hay, hay que seguir de manera estricta las reglas determinadas por la autoridad sanitaria o la autoridad pública a nivel nacional o a nivel del municipio. Cuando esos dos grupos de medidas se juntan, el riesgo infeccioso a partir de cadáveres de personas fallecidas de COVID-19 es casi nulo, es inexistente. Realmente quisiera destacar de nuevo el conjunto de dos series de medidas de control de infecciones y medidas de salud pública. Gracias.
Gracias, doctor. Ya estamos llegando al final de la sesión informativa de hoy. Tenemos varias preguntas vinculadas con vacunas aún y para juntar más o menos algunas de las consultas, la siguiente pregunta dice, supplies of vaccines are likely to be limited, especially for low and middle income countries. How confident is PAHO that the rollout of a vaccine will be fair and equitable in Latin America and the Caribbean? Doctora Etienne?
So thank you for that important question. And I can see there's a lot of interest around vaccines and the access to a COVID-19 vaccine. So our work in PAHO is based, as I've said before, on the principles of solidarity and equity, and from the beginning of PAHO. And the COVAX facility is based on these principles. And so that's why one of the really very important reasons why we are working hard in the COVAX facility to represent our member states. This really, as Dr. Barbosa has just said, is an unprecedented partnership that is working to achieve something that has proved very difficult in previous outbreaks. And that is ensuring that every country, irrespective of their income level, would have equal access to safe and effective vaccines without too much delay. So this really is the first time that we have a mechanism in place before a vaccine is registered. And we believe that it will make a huge difference. But I want to reiterate something that was said before. Really, let us be clear that initially the supply will be limited everywhere, regardless of whether the countries are participating in the COVAX facility or those who have had direct bilateral negotiations with pharmaceutical companies. So we know that there will not be enough vaccines for all at first. And so the goal will be to prevent severe illness and deaths. And both Dr. Barbosa and Dr. Espinal have mentioned this. And so that's why in PAHO we have been advising countries that the first doses should go to those at the highest risk of infection. For instance, our healthcare workers and the elderly. And after this first priority, uh, groups, we expect to see a gradual rollout of doses that would allow countries to offer the vaccine to other priority groups, like persons with underlying conditions, and to eventually reach others who may not be as vulnerable to severe COVID-19 symptoms. So, as you heard, it's going to take some time. It's going to take beyond 2021 to arrive at the goals that we set ourselves that will control transmission. But really, we are eager to see COVID-19 vaccines broadly available, but it is important to understand that it will take time and that coordination across countries will be essential. Um, we are counting on our member states to share resources, to work closely with PAHO and the COVAX facility to ensure equitable access to the vaccine. The majority of us must all be protected so we can end the pandemic, control transmission. And as has been said before, until then, we will need to rely on what we know works well: social distancing, the wearing of masks, and the avoiding of crowded indoor spaces. Remember that a vaccine is only one of the tools that we will need to control COVID-19. And a vaccine will work better in combination with other measures. So we are looking at a total and holistic approach to the reduction of transmission as we move forward to ending the pandemic. Thank you very much for being with us.
Muchas gracias, doctora Etienne, y muchas gracias a todos por acompañarnos. Ya hemos llegado entonces al final de la sesión. En nuestra página web panel de la OPS con información sobre la situación de COVID que mencionaba la directora en su discurso de hoy. Allí pueden ver una imagen. Nuestra página web es www.paho.org/coronavirus y allí pueden encontrar esa información. En breve les vamos a estar enviando las palabras de apertura de la doctora Etienne, así como la grabación de esta sesión. Y como siempre pueden seguir en contacto con nosotros a través del correo electrónico que les estaremos contestando lo antes posible. Así que muchas gracias nuevamente por acompañarnos hoy y nos vemos la próxima semana. Saludos.